Welcome back. Our next guest is Dr. Buzz Walton of Helena's Performance Injury Care and Sports Medicine. Welcome to our show, Dr. Walton.
Thank you very much for having me.
Sure.
Yeah.
The first thing I'd really like for you to explain to all of us is what really a concussion is.
A concussion, basically it's a huge public health problem, and I'm glad that the society is coming to grips that we need to kind of try and do something about it. So a head injury, a concussion, is it's a type of traumatic brain injury, and it's caused by a bump, jolt, or blow to the head, or even a hit to the head or neck that causes the brain to move rapidly back and forth. Usually on a head injury, they're pretty unique in regards that they're all different, and everybody's different too, so not everyone's going to have the same symptoms. Okay, and they're an evolving process too. So symptoms, an athlete could have symptoms minutes after the injury or 2 to 3 days after the injury. So it's they're pretty unique in that way.
Okay, so sometimes you hear of somebody saying, I've had a mild concussion. Are there different levels or types of concussions?
In the past we used to grade concussions, but right now there's no level. A head injury is a head injury, and we treat them as such. So no one's treated differently in regards to that.
You said a little earlier that people react differently to the concussions. Can you tell us what some of the symptoms are of people that have had concussions?
Sure. So the symptoms are broken up. There's 4 categories of symptoms of concussion. So one of them is going to be the physical signs. They're going to have the emotional signs. You're going to have the cognitive, as well as also sleep. So the physical signs, for example, they can be the headache, they can be the neck pain, dizziness, nausea, and vomiting. Okay. The emotional ones that we see a lot, especially in our younger kids, sadness, depression, anxiety. Right? We have the sleep category, which these patients are going to have difficulty falling asleep or staying asleep. And the cognitive. The cognitive are difficulties with concentration, difficulties remembering. They're going to feel like they have a brain fog, and even word finding difficulties, which is very challenging, especially in our adolescent and our high school age patients.
So if a parent or someone thinks that they've had a concussion, what should they do?
So what should they do? Well, based on the Dylan Steigert's Protection of Youth Athletes Act, that was passed in 2013, if the athlete is suspected to have a head injury or has a head injury, they need to be taken off the field of play. Okay, they need to be seen and evaluated by a healthcare professional who has a basic understanding in concussion management.
Okay, so would you advise parents to let children wait and see, or do you like to try to get them in if they're having a symptom?
It's better to get them in as soon as they can.
Okay.
Kind of what we're finding out. The treatment of concussion is changing every day. We're finding out different things almost every month, what we didn't know last month.
Okay.
So what I would recommend is getting these kids in as quick as you can, because the outcomes are going to be a lot better.
Okay. And we've heard a term of impact neurocognitive testing. Can you tell us what that is?
So impact neurocognitive testing, it's a computer-based neurocognitive testing tool that we use as healthcare providers to kind of help us evaluate and manage a head injury. And I want to stress a tool. Okay, it's a tool that we use, so that's not going to be the sole thing that we're going to determine to let these kids go back to play. So we have to make sure we use the impact test, we use the physical findings on exam, and we also get the help from the physical therapist. So we use a bunch of things in order to get these kids safely back to school and back to field of play. It's not just using that impact test.
And we've talked a lot today already about concussions related to football. But I'm guessing that people can get concussions from a variety of other sports or activities. Could you tell us some of the other reasons or things that you're seeing that people are getting concussions from?
Yes, so it's not just it's a football-related sport. So concussions can come from so football, girls lacrosse, male lacrosse, girls basketball, girls volleyball, male basketball. We even see cheerleaders. We even see dancers as well. So it's not just a football-related injury.
Okay. And we also know or suspect that concussions might have lasting effect on people's memory. Just quickly, can you share with us what you're seeing or what you know about how a concussion can impact somebody's memory?
Well, that's and we're still the research is still pending on all that stuff. Okay. So we're really not sure on the long-lasting results of a head injury. So we're still. We're still kind of waiting for all that research, okay. But what we're finding, it's the stuff is still mixed.
Okay, great. Thank you so much, Dr.
Sure.
Walton, for coming and sharing great information with us.
Right.
So stay tuned. Next up, we'll hear from the University of Montana's Neuro Injury Center. We'll be back at the break.